Hello everyone, welcome to Meded. My name is Ngoya Nicholas and I'm a pharmacy practitioner. I'm very delighted that you've taken your valuable time to watch this video. So please, if you are new to this channel, please share this video, subscribe and hit that notification bell so that you may be notified for future videos that I post on this channel. So today we are going to delve into another type of NSAID by the name Mefenamic Acid. We know this medication is available in different brands all over the globe. So I'll mention some of these brands. So today we'll tackle the uses of mefenamic acids, the side effects, what it is, who should use it and who should not use it, and also some common precautions that you have to consider when using this medication. So let's delve in. Before we dive into the world of medications, a quick reminder: this channel is for informational and educational purposes only. Always consult with your healthcare provider before making any health decisions or popping any pills. Let's keep it smart, safe and savvy. So back to our topic of mefenamic acid. So just to start, whether you are dealing with the stubborn cramps, post-surgery aches or fever that just won't quit, mefenamic acid is here to save the day. These little pill packs are powerful punch, making it a staple in many medicines cabinets. So let's roll up our sleeves and get to know this mighty medication a little bit better. So what is mefenamic acid? Picture it as a superhero in the NSAID universe. It's like the Spider-Man of pain relief, nimble, effective and ready to swoop in and save the day. Mefenamic acid is commonly used to reduce pain, inflammation and fever. It's your go-to for those menstrual cramps, dental pain, muscle aches and even post-surgery discomforts. Its versatility makes it a favorite among doctors and patients alike. Next time pain strikes, think of mefenamic acid as your trusty sidekick, ready to tackle the toughest pain of valence. Okay, so now how does mefenamic acid work? Just to recap, as we had discussed the mode of action of the previous medication, mefenamic acid has the same kind of mode of action. That's how it works. Okay, so because this is another type of non-selective non-steroidal anti-inflammatory drug, so let's just touch on how it works. So it works by blocking the production of prostaglandin. These are the chemicals in your body that are responsible for inflammation, pain and fever. So think of prostaglandin as the valence in our story, okay, and mefenamic acid as the superhero that swoops in to neutralize them. By inhibiting the enzyme cyclooxygenase, it reduces the production of this nasty prostaglandin, giving you much needed relief. It's like cutting off the valence power supply, leaving them powerless and you pain-free. A clever strategy, don't you think? So what does mefenamic acid treat? This medication is versatile. It is commonly prescribed for menstrual pain, muscle aches, dental pain and fever. Okay, but regarding fever, just as we had spoken in my previous videos, if you have not watched those videos, please go back and watch them. They're so informative and you'll get more information on some of these medications. So for fever, maybe you can use other good medication just like paracetamol to manage your fever. But if your doctor prescribe mefenamic acid, then you have to comply with your doctor's prescription and advice. Okay, so that was just my advice. So who should use mefenamic acid? Mefenamic acid is suitable for adults and teenagers who need effective pain relief. It is especially handy for those who suffer from dysmenorrhea. Dysmenorrhea is basically painful periods. It's the other meaning of painful periods, and it is also used to relieve pain in other acute pain conditions. If you are someone who experiences frequent muscle aches from overexertion or sports, this medication can be a real game changer. Just remember, while it is great at what it does, it is always best to use it under the guidance of your healthcare professional to ensure it is the right fit for you. Okay, so don't use it before maybe consulting your healthcare provider. By healthcare provider, I mean your doctor or your pharmacist. Okay, so who should not use mefenamic acid? So mefenamic acid is basically prohibited inside this group of people. So in pregnant women, especially in the third trimester, so it's not go for the expectant mothers. So if you are an expectant and maybe you have that thought of using mefenamic acid, please just drop it and go for doctor's advice for other safer medications. Okay, so it is also prohibited in individuals with a history of allergic reaction to NSAIDs. So if you have had adverse reaction to other NSAID, please do not use this medication. So it is prohibited with people with severe heart, liver or kidney disease. So your organs will thank you for avoiding this one if you have those conditions. If you have a severe heart disease or liver disease or kidney disease, and basically do not put stress to your organs to use this medication if you have such conditions. Okay, it is also prohibited to those with active gastrointestinal bleeding or ulceration. So do not use that medication if you have ulcers, if you have any bleeding disease, because this medication exacerbates these conditions, making matters worse. So you are advised not to use this medication if you have such conditions. So some doses and dosage forms. So mefenamic acid is typically comes in 250 milligrams and 500 milligrams. Okay, a tablet is a tablet. So in adults, usually the dose is 500 milligrams initially, followed by 250 milligrams every 6 hours if needed. Okay, the maximum duration of treatment should be 7 days at least, but most doctors prescribe this pain relievers for 3 days only. So in children, it is not commonly recommended for children under 14 years. Always follow your doctor's instructions regarding the dosage. Also, okay, as taking too much can lead to serious side effects. Okay, it's all about finding it's all about finding that sweet spot where you get maximum relief with the minimal risks. So the common brands available globally include Ponstan that is available in the UK, Ponstel that is available in the USA, also other countries in Europe. We have Ponstan Fort available in Australia, and also many countries, even US is also available. We have Ponstel caplets in Canada. We have Dolphinel in Philippines mostly. Okay. So let's look at some of the common precautions when you are using this medication. So before you start using these mefenamic acid pills, you have to consider the following precautions and take them into consideration when using them. So always take it with food. This helps prevent stomach abscess and reduces the risk of gastrointestinal issues. Okay, avoid alcohol. Mixing alcohol with mefenamic acid can increase the risk of stomach bleeding and other adverse effects. And also stay hydrated when using NSAIDs. Because this can be tough on your kidneys. So drink plenty of fluids to keep things flowing smoothly. Okay, monitor for the side effects. So watch out for signs of gastrointestinal bleeding, such as black stool or vomiting blood, and seek medical attention if this occur. Okay, and also avoid driving or operating heavy machinery if you feel dizzy or drowsy after taking mefenamic acid, and also consult your doctor before using if you have a history of asthma or other respiratory condition, because just as we had spoken, these NSAIDs, most of them, they make the condition of asthmatic attack worse or any other respiratory diseases worse. Okay, so they just stimulate or they exacerbate it. So consult your doctor before using it if you have a history of asthma or other respiratory conditions. Also have regular checkups for if you are on long-term NSAID therapy, okay, to monitor your kidney function and overall health. It's all about staying safe while getting the relief you need. Always keep communication open with your healthcare provider to ensure the best outcome, right? Regarding the side effects, if you've not watched my previous videos, you can go back and watch them, since we are dealing with the non-selective non-steroidal anti-inflammatory medications, and I don't want to keep repeating the side effects of these medications because they are all the same. So if you've not watched my previous videos on the other non-steroidal non-selective NSAIDs that I've already covered, you can go back and watch. So, and there you have it, folks. Mefenamic acid, a reliable sidekick in your battle against pain and inflammation. Remember, always consult with your healthcare provider before starting any new medication. If you enjoyed this video, give it a thumbs up, please. Share it with your friends and hit that subscribe button for more Meded magic. Okay, stay healthy, stay happy, and see you in the next video. Bye.